Hi everyone, welcome back to Angel Nurses YouTube channel. Today in this video we are going to discuss about pressure store stages and the care of each stage what we will do. Okay, there are mainly 4 stages. Let's see one by one in detail. This is the images of all 4 stages. Stage 1 we can see only the redness. There is no cut wound on the skin. Stage 2 it is already blister. Blister may open or not. Maybe blister will be closed only. In stage 3 blister is open already and the wound is started. It's going down and it is touching to the subcutaneous tissues. In stage 4, it's already very deep, bony, permanent. It is touching. So this is the images of 4 stages. In a deep introduction, what is pressure sore? We have in my previous class, I told what is pressure sore. Once again, I'm repeating the same. Anyway, we are learning this class about the stages. No, so what is pressure sore? Pressure sore is also known as pressure ulcer and decubitic ulcer. It is an injury under the happening in the skin because of the and underlying tissues also. It is an injury to the skin and the underlying tissues. So, what is the reason? It is because of the prolonged pressure is happening to the skin. That is the reason that injury is happening. And it is the most common over bony areas like tailbone, hips, heels and ankles. Why staging is important? So that we can give the care according to the stage. What care we are giving in stage 4 that no need to give in stage 1 and 2. Okay, so each stage different care we have to give to heal the wound, heal the ulcer. Okay, to accurately classify the severity of the wound, to guide the care plan and treatment, to monitor the healing progress. Now let us see stage 1 pressure sore, how it is appeared. The appearance is the skin is intact. You can see the picture. The skin is intact. There is no open wound. There is localized area non-blanchable redness. There is a redness over here. Localized area. This means the red skin doesn't turn white when you press it on. Your fingertip, if you press, it will become red. And after releasing, it will become white. That means there is enough blood circulation. But whereas in this area, if you press also, it is not going to be white. Okay. And the dark skin tone, it may appear persistent purple, red or blue in color. You can see this area. This is the one is going to be turned next stage as a wound or blister, and on opening the blister, then the wound will happen over here. All area, but sore won't come. Here and skin peel will happen. But here the wound will start. You can see the darkness over here. The area may painful, firm, soft, warm or cooler comparing to surrounding tissue. This will be warm and cool and soft. Care. What care we will give in a stage 1? Relieving the pressure. Because of the pressure only this was happened. So we should relieve the pressure. Repositioning the patient every 2 hours or as per the protocol. If there is any restriction, we can't do it every 2 hours. According to the protocol, we should do that. Skin care. Keep the area clean and dry. Use protective moisture barrier cream. Nutrition. And ensure the adequate hydration and nutrition support is getting for the skin health. We should give information to a nutritionist. So she will decide what nutrition patient should get. Either from the hospital side they will prepare and give, or they will give the education to the health education to the family members. They can prepare accordingly. The menu they will give. Let's see stage 2 pressure sore. How it is appearance. Please look at the picture. Partial thickness skin loss. Skin loss is happening over here and started blister. Blister is open here. Here blister is starting but there is no open wound. It's entry of the stage 2. This is already in stage 2. Partial thickness in the skin loss. The wound look like shallow open ulcer with or without within a red color or a pink color wound bed. It may also present a shiny or dry blister with or without a break. This is already broken. That is filled with the fluid. There is no slush, no unsure will be present in second stage. What care we will give? Wound dressing we have to give. Clean the wound with the normal saline, apply suitable dressing and apply the moisturizing cream and microbial cream according to the doctor's order we have to follow. Pressure relieving has to be happen, repositioning the patient, providing pillows, soft gel pads, and massaging to the patient. This we have to give proper health education to a patient and care worker also. Who is caring the patient and while turning the patient, what they have to do, especially pressure points are there. There, what massage they have to do and how to keep the patient. Patient should be in a dry, should not be in a wet surface. So these all education, health education, so we are supposed to give for the care workers and to the patient also. Why we are doing for you? Why we are giving you this care? What's the important of this? This all education should be happen in the stage 2. Now stage 3, the appearance. Please look at the picture, how it is. Already full thickness tissue loss is happening. The wound is open already and slush is present already. Bone, tendon muscles are not exposed. Slush is there. Tunnel is there. So what care we will give for this? Debridement we have to do it. We should open the wound and show to a doctor. So that doctor will tell what care you have to give. Every day no need of doing the debridement. But dressing has to be happen every 8 hourly so that the healing process will be very much helpful. Dressing, how the dressing? There is a chance there will be drainage more. So extra absorbent pad we should keep. Moisture we have to keep. Keep the wound should be moist. Nutritionist, she is having a big role in here. She should supply for a high protein supplements and all for the patient. Health education is very important to a patient and patient attendant. Why it is happening and how it will heal, how fast we can heal the wound, repositioning the patient, and all other care we should follow. Stage 1, what we are following, all other care we have to follow, repositioning the patient, giving support of the pillows, soft pillows, gel pads, those, and applying the air mattress, all these things is very important. That care I have already explained you in another video. So this is the stage 3. In stage 4, the appearance will be full thickness tissue loss and exposed bone, tendon or muscles. You can look at this picture. It's very deep. Slush may be present. Often tunneling is there. And the wound appear very deep, potentially extending to the bone. What care will give? In this advanced wound care we have to give for the surgical opinion. Mostly surgeon will take the patient inside the operation theatre. Then with the sedation only they will do the debridement because it's very painful because deep wound. The patient is conscious. It is really very, very painful. An infection is, it will start fast getting infection and all. So infection control, we have to inform to the infection control people. Monitor the sign of infection. It is very important. Patient is having any fever, foul smell from the wound area, increased pain is increasing. It has to be managed with the antibiotic as per the prescription. Repositioning. That for all the stages we should do the positioning according to the patient. Depends upon the patient condition. Strict adherence to turning the schedule in a critical because patient is having very big wound. It is very dangerous and it is very painful to the patient. You have to take care of the patient. The deep tissue injury is happening. Then after stage 4, that is unstageable. We can't tell which stage it will be unless or until we have to remove all the slash and debridement. Then we'll see whether we can tell fourth stage. If more than fourth stage the deep is there, that is unstageable. Unstageable pressure injury, full thickness, skin and tissue loss. The acute depth of the wound is obstructed with the slash. You cannot determine the stage. Deep tissue pressure injury, DTPI. Deep tissue pressure injury is happening there. Purple, maroon, localized color, we can see the area. You can see, with, please watch the picture so that it will be understanding. Causing by a damage to the underlying soft tissues. This area may feel boggy, warm, cooler, and rapidly evolve into full thickness of ulcer. And care will be same like stage 4. Other than that, surgeon will see it may go for the surgical treatment like skin grafting and all. Okay. So this is really very tough stage. So beyond the level of fourth stage going, it is very difficult to manage, and healing process is there is no guarantee. We can't tell because depends upon the patient health condition. They may decide whether the patient can go for the skin grafting or not. It is very important to know the pressure points so that we can give more care to a patient. Back of the head, occipital region, shoulder, that is our scapulary region, elbow, lower back and buttocks, sacral region, lower back and buttocks. In lower back, the sacral region is the more prone to get the pressure. So, hip, inner knees, heels. These are the main pressure points where we have to give more attention and care. Hope today's video is helpful for all the nurses. Thank you all.